This is the tiny guide to endometriosis. I'm hoping that this will help build a foundation so that you can get healthcare providers to listen to you. In order to get people to listen, you have to know what's going on so you can advocate for yourself. Let's go over a few of the points. Endometriosis is an inflammatory condition that involves the proliferation of endometrial-like tissue throughout the pelvis and abdomen. The cause is unknown. Endometriosis is incredibly complex and it involves a whole bunch of different factors, and these are probably interplaying between each other. It's not going to be a single thing. A point that gets glossed over in the education involving endometriosis is that there is more than one kind. This is not a one-size-fits-all kind of situation. And even if you have it, your friend may have a different version, or it arose from a different set of circumstances, which means it's not cookie cutter. It does mean that you might have a lot of crossover and shared symptoms. The thing I want you to pay particular attention to if you are a woman or a person with a uterus who is seeing this is if your periods are extremely painful, like they are debilitating you, that is not normal. If you are seeing this list and you're like, I have a lot of those symptoms, then it is time to start your journey down seeing if endometriosis is the problem. This sad statistic comes from pain during periods being normalized. It takes a long time to even get on the road, and once you're on it, you're going to have to push hard to find out whether or not you have this. These tests can help you narrow it down. And this last one, this surgery, is the only way to know for sure. They take a sample, they send it off to a path lab, and they get the histology done on it. So that is where they take a look and they confirm that that is exactly what those cells are. Weird fact for you, males can get this, but there is always a compounding factor. If you have ever wondered what it looks like, here it is. It is these dark chocolate-looking spots, okay? It can also appear as cysts on the ovaries. It can be deep infiltrating. It can come in a lot of shapes and sizes. Here you will see the beginning of that breakdown. Superficial, endometriomas, and deep infiltrating. Deep infiltrating is by far the worst. It means that it's actually invading the organs. Just like with PCOS, there are some supplements out there that might help you, okay? Treat them like medicines and talk to your doctor before you go start making changes. The worst news I have for you is there is no cure for this. A hysterectomy will never cure endometriosis, and surgery is the gold standard. This is sort of the goalpost for treatment. That's not to say that medications like this right here might not help, but for a lot of people, removing it is the only thing that brings relief. I'm going to get out of the way so you can take a screenshot. As always, thanks for learning with me.